Hello everyone, welcome to this episode that we are going to discuss about mental health. The topic of today is about mental health, especially during this time that the whole world has been affected by COVID-19. Let's pray. Dear Father, we come before you because you are the one who created human being in your own image. And you gave us power to think. And Jehovah Lord, the Bible reminds us about the renewal of the mind. Because Lord, what is in our mind make us to achieve the potential, the reason that you created us in this world, Lord. Therefore, Father, as we start this discussion, may your presence go with us. In Jesus' name we pray. Amen. Thank you. Welcome once again. And I want to thank those who have been part of this channel. Thank you for your comments. I really love the comments that you are giving. Thank you for those who have subscribed. Now you are able to receive many episodes as they come in. I want also to thank those who have shared, and even those who have liked. We appreciate all of you. Today, we are going to talk about mental health. And with me, I have two gentlemen who are going to help us in a professional way on how can we deal with mental health. And as I said before, we are talking about mental health, the effect of mental health during this time of COVID-19 and even the result after. With me, I have my brother, Czar Odongo, who is not a visitor in this channel. Czar Odongo holds diploma in social work and community development from the University of Nairobi. He also holds Bachelor of Art in Sociology and Psychology from the University of Nairobi. He is the Kenya representative in Genesis Design Organization. This organization that deals with developing age-appropriate Bible lessons and resources based in Namibia. And the other guest that I have is a brother, born-again Christian. I know him as a youth leader for many years. He holds a diploma in chaplaincy, part of hospital. He's a hospital chaplain. He also is a holder of Bachelor of Art, Counseling Psychology from the Kenyatta University. Master of Art Counseling Psychology. Is a student doing a Master of Art Counseling Psychology. He's a practicing counselor in a treatment facility based in Limuru. So in other words, you can get that we have a professional psychologist who can really help us to understand the issue of mental health. So welcome as we continue. So brothers, welcome so much. Czar, we were with you here the other week. How have you been?
I've been doing well, thank God. Kept healthy.
Yeah.
And just following the rules
of the government.
Yeah, in order to stay safe and to stay alive.
Oh yes.
Yeah.
It has been too long.
Sure.
I don't know whether I attended the last time I saw you was in your wedding. I don't know how many years ago.
2 years ago.
2 years ago.
Sure.
How is marriage life?
Marriage life, it's learning every day. So it's a school.
It's a school?
Yes.
Do you practice what you have been trained in school? I know you as a good counselor. How does that knowledge help in marriage? Ama mganga jigangi?
Mganga is jiganga because to be honest, my wife is also a counselor, a psychologist.
Wow. Oh, great.
Trained in the same university, same lecturers, same year.
Mulipatana kwa class?
Yeah. So, what we believe as professional counselors, you can't do whatever you do to your spouse or even your children. It's very, very unethical. So anytime that we get our issues, we also seek help.
where sometimes you seek help from people, maybe the academic level is lower than you.
No, people that the academic level is
A bit
slightly
higher.
higher, or their practice has tested time.
Oh, okay. Yeah.
So we could be at the same level, but they've practiced for quite some time. Yeah.
Thank you so much. First of all, I'm so much glad to host you today in this channel where we aim to reach especially young people from age 18 to 40, and even the older one who can follow us. And having you people who are professional, it's a great joy to me, and I don't take it for granted.
Sure.
Now, let's just go direct to the topic of today. And I want you just to check on the impact of COVID-19 on mental health. You know, this COVID-19, nobody have prepared for it, and it just attack us. So I don't know I want you to share with us some of the impact of COVID-19 on mental health, and look at the positive and the negative. I'm told a coin has two sides, and therefore I'm sure that there's the good side of COVID-19, which I know majority of people cannot agree, but I believe that at the end of this, people will come and understand, by the way, there's some positive and the negative. And I will just start with Caesar. Some of the impact, the positive impact of COVID-19, positive and negative.
Okay, thank you very much. The COVID-19 came and just put a very huge pause on the world, you know. It's like God pressed the pause button, and everything really stopped across the whole world. Many times we're used to maybe one area stopping, one country stopping, but you know, this has just come to pause everything in the whole world. And one of the things that I can say positive has happened is that at least people were able to take a rest a bit, you know. Especially these people who have been going to work Monday to Monday, every day of the week. You know, they came to a point where, you know, they had to sit home a bit, take a rest, relax, and take things easy. So at least it was a good opportunity for them to even re-energize, to re-strategize, to get fresh energy, fresh ideas, and yeah, I believe that once things are on course again, their mindset going back to what they used to do will be very different. You know, we are very accustomed to a pattern, but now we've seen that it's not about that pattern alone. Yeah, we can go to something different. So like we've learned that it's not a must for me to go to an office to work.
You can work from home.
I can work from home. Yeah, so I don't have to go to an office to work. I don't have to fly from Nairobi to London to have a meeting. Like we can meet here.
Online meeting.
An online meeting. When they're there and I'm here, we can meet and talk. So it's a good thing. And in terms of family, you know, the families have really benefited in some way, because I believe relationships have been improved, because now we're staying at home, we're here, we have to deal with issues together head on, and I believe that it has really improved families, especially maybe families that really had absentee parents, absentee fathers, absentee mothers. You know, at least now the children can be able to be socialized, they can be able to get a model at home. Yeah, maybe if it's a boy child, they can see how the dad operates. You know, maybe some of them just used to see dad on weekends, on Sundays. But now they can see how dad operates from Monday to Monday. And they can say, okay, dad operates this way and this way, or mom operates this way and that way. So they can be able to learn from them and even become better people in the future. So it has really helped in that way. Another positive that I can say it has helped out is that people have become innovative, you know. Now that they can see everyone is a baker, everyone is a gym instructor, everyone is
an entrepreneur.
Yeah.
And at least even now, we never knew Calvin will be a TV host.
A TV host.
So as in, it has really been able to give us innovation, you know? And it has brought the talents out of us, it has brought it has brought a lot of energy out of us, so as in we can be able to explore areas that we were afraid of exploring before. We can go there and step with boldness, even in areas that we've never stepped out before. So it's really good.
You can also follow the services, your services from home, the church one,
Yeah,
the
church,
mosque.
yeah, you know?
The mosque also follow it
Yes.
through
Yeah, they
online,
do.
yeah?
They
Uh-huh.
do. They do.
Also online, yes. So it's good that here now, even in church, you know, some people are not going to church. And it's good the church has been brought to them at home.
At
now,
home,
you know?
yeah?
Yeah, so as families, we can build our fellowship at home together. Can be able to pray together at home, sing together, share the word together. So it's really something positive that has come out of that. As much as we might be seeing some negatives here and there, but positivity has also come. We're also very heightened in terms of hygiene now. You know, now we wash hands very regularly, and we are very cautious on how we wash hands. We are very cautious on how we touch things. So it's really a positive thing. You know?
Yeah.
So as in, I believe it will go a long way now in life to teach us on how to function and how to operate now in our normal
Functioning. I see even my church where I worship, now we go online,
Yes.
which I believe that they will continue going online forever. So that's an advantage. Maybe without COVID-19, we could have not thought of
Sure.
having an online service. I don't know, some of the
Now,
positive.
there's a priest that I had a talk with, I think 2 weeks ago. This was the comment. If we go back to our normal lives, then we are very stupid. So what I've learned through COVID, now the cohesion of the family, as Caesar was saying, now the absent present parents now are present, if there's something like that. So there's no way a child will see the father on Sunday with a newspaper and a remote only on Sunday.
Yes.
So this particular child is going to grow knowing that there is mom, there is dad, there is brother, there is sister. So the unit, the simplest unit in the society, which is the family, has been brought together.
Yes.
So as time goes by, this fabric family is going to be very intact. I'll give my own example. I've been a little bit away from work because of the secession of Nairobi and the movement. So I've been home. So I've been seeing particular patterns, even with the kids. Kids, when they're playing, because kids, you can't tell them, don't play with this child, don't play with this child. So in my neighborhood, for a kid to play with another kid, the first thing, where is your mask? The second thing, have you sanitized? So there is a new normal, as Honorable Mutai Kagwe usually says, there is a new normal. So this new normal is giving us a particular discipline that we have to do this to avoid this. So with COVID, things have changed. And things are still yet to change for our country because they are saying the peak is not yet. So before we get to that particular peak, as Kenyans, what can we do to avoid getting to the numbers like in Italy, in Spain, and currently in the US? So there's a lot of positive that has come. There is more to come, only if we remain steadfast in the rules and regulations that have been put by the Ministry of Health and our own discipline as Kenyans, because tunajua tu Wakenya ni wale. Utamwambia usifanye hii, atauliza. Anafanya the exact opposite of what you're trying to tell them not to do. So it's our humble appeal that let us just be self-disciplined, because if Patrick remains disciplined, Caesar remains disciplined, and Calvin remains disciplined, then there are over 47 million Kenyans. If each person takes responsibility on their own, then things will be okay. Yeah.
And so what are some of the, when I take you back to church, I remember you were once a youth chairman, and when we talk about priesthood of all believers, or when we talk about now, you have your service in the house. Is there any positive thing that this time you have learned as a family?
Of course, a family that prays together stays together.
Yeah.
So there is no one time that you will expect Reverend so and so to come and perform particular quote unquote church rituals in your own house.
In your own house, yeah.
Because when you look at the olden time in the Bible, there was this particular tribe, the Levi, or the tribe of the Levites. They were purely priests. Now, as men, that is our call from God, that you make your house my place of worship and be the priest of that particular house. So what has happened in between March and today, I found myself praying more in the house. Any little thing that comes our way, what is our first defense? Prayer. What is our second defense? Prayer. What is our only defense? Prayer. Because social distancing has said you can't gather more than 15 people. You can't gather, even in your house, the home fellowships, they've been stopped. Like where I fellowship, we usually have fellowships every other Wednesday, alternate Wednesdays, through Zoom. So, and we have neighbors around, we fellowship in the same church, but we cannot mix.
Yeah.
So the thing is, our families have been made to pray even more. Families are now praying together. Even them who feel they don't know how to pray. They just make a very simple prayer. God protect us. That is enough. God just wants us to acknowledge his lordship. As simple as that. So that is another positive, that even children can pray and say, God protect mom and dad as they do A, B, C, and D, so that they don't contract COVID. So that is another positive, that now even the priesthood within the same house has been heightened. People celebrate Holy Communion with their families. You don't have to have the elements that we use in the big cathedrals. I remember a communion that we celebrated via CITAM. Bishop Oginde was like, you don't have to have those expensive elements. If you have your piece of bread, if you even have a glass of water, that's enough. So as Caesar was saying, people have become creative.
Innovative.
So it depends. Do you believe in these elements as a symbol of the body and the blood of Christ?
Yeah.
So long as you believe in that and you make them acceptable before God's eyes, that these are the elements that we are presenting to symbolize Christ, then God accepts that. Yeah.
Thank God for the CITAM Church.
Sure.
I wish your church, the Anglican, and the Catholics, and we are waiting for the church of the Anglican, maybe the Archbishop or the Pope, to tell us how can we handle such cases. So we can say that the COVID-19 had a positive one. And again, I want us now to look at the negative part of COVID-19. Even when church is resuming back, there are measures that have been put on board that the churches need to follow. And I know even in the place of work, in school, so we have another negative part of COVID-19. Some of the negative effect of COVID-19.
Well, I'll dwell on the social part, really. As Africans, we are very accustomed to touch and being close to one another. We are very accustomed to handshakes,
huggings.
You know? Yeah, that's our lifestyle. Closeness is part of what we are very accustomed to. Even we know before, the matatus, we used to be so many the matatus, yeah? And of course the conductor said, pendaneni hapo,
show love.
So, you know, it's what we've been used to, and you know, now things are changing, people have changed, and we have to shift from where we were, you know, even in terms of just a simple visit to someone. Now it's a challenge, it's a burden before you think of visiting a relative.
Visiting a relative, yes. Yeah.
It's really a challenge, and it has its effects. It was normally easy for you to visit someone, for them to feel love, for them to feel that, when people care for me and all that.
Yeah.
But now, if you are just alone, it's still with your family. You're still there, give yourself company with your family, and you can have your talks there and all over. So it's really been a big blow to what we're accustomed to.
The social part of it. There's a pastor who told me recently that he went to visit a certain family, and they were told, "You pastors, you are the people killing us in Kenya. You kill people in Italy, and again you want to kill us here." So you found that even pastors are unable to go and do pastoral work.
Yeah, that's very true. So it's a big effect. Even not only pastors, even for the congregants for themselves to go to church.
To church, yeah.
To see the pastor, it's very difficult because even some of the pastors will say, "Hey, mnipigie simu ama tuongee kwa Zoom."
Kwa Zoom, yeah.
Usikuje, hata mimi naogopa kuna nini? Kupata corona. So it's really two-way, and it has really affected us because we are so much used to this one-on-one interaction, the way we meet, we're used to that, and we're used to the feeling, and a person who is there with you and talk to you and tell you something. For us, phone conversations are not really complete at times.
Oh yes.
I can talk with someone on phone for 1 hour, but until I see them, it's when I feel that yes, my need maybe has been met somewhere.
Let's meet for coffee in town, in Java.
Yes. Once that has happened is when I can feel yes, my meet has been met really well. Maybe if I go to pastor and pastor prays for me in his office, then I feel that yes, shida yangu imetokea. But now when pastor tells you let's pray via phone, like I won't feel that prayer. So it's been really a challenge on that part. And when we don't go to maybe on, let me jump a bit on the sector of even being together. Maybe you have a sick person in hospital,
COVID,
you cannot even go to visit them.
Your own father or your own wife, you cannot visit.
Or even your own child.
Yes.
So you can hear someone who has been in hospital for like 30 days, but their family has not been able to see them. They just go, they take maybe drugs there, they take medication, everything there, but they cannot even see this person for this many days. So it's really a challenge for them, and you also find for these ones maybe who have even lost their loved ones. As Africans, we are used to a very good mourning period, elaborate mourning period where we can mourn a person and we can celebrate their life, and we can console the family. The family normally feels some good warmth when people are around them. So now it's different. Now you find that the restrictions, like they say, 15 people only. And maybe you're from a big family like mine, where we're like more than 100 people. You wonder where
under the same name.
Under the same name. Where will the others go? Where will the others come and console us? So
you have lost a grandmother who has over 200.
Yes, the grandfather was over 200 grandchildren and children
and great-grandchildren.
So it becomes a big challenge.
It's a big challenge indeed.
So it has really changed how we operate. And we just hope that things will get better. And because we don't want to lose also our culture. This is African culture, which we need to maintain. Yes, about getting together and just having one time together as people. Yes.
You remind me on one last Sunday during this period of COVID-19, we really struggle with the praise and worship team and even the preacher, because there was a time, give a high five to your neighbor, do this. So it was a not easy thing. And I see even in a church whereby when people want to celebrate Holy Communion, the priest could say, now share peace. And when you share peace, you shake hands.
Or
even it was a problem. It was like, now wave to your neighbor. And it was, it's not our social way of worshiping.
That's very true. That's very true. Even for a preacher like me who likes saying, give an amen. When I'm preaching one line, if I say give me an amen, I won't hear the amen. Get the motivation, So the motivation at times it's hard for the preachers out there, and
even the preachers who can preach 1 hour nowadays, they are preaching 10 minutes.
Yeah, sure.
So
Mr. Nyagudi,
there's something that Caesar has brought to our attention concerning maybe our culture. let's just go Western. You lose a person. Will take close to 3 weeks before the interment of the deceased. But now look at it at this particular time. God forbid if you pass on with corona. I think the policy, they are trying to make it a little bit bearable for the cultures. I think that was on the update either yesterday or yesterday, but on by Dr. Amoth, that they are trying to get the policy to allow people to mourn enough. If we look at the case in Siaya, the guy that came from, I think, Mombasa, died, was buried in the dead of the night. So what are you leaving the family with? There's a lot of psychological torture.
Okay.
Because the death is abrupt. The burial is almost immediately. So there's no closure that, okay, this person has died. Okay. This person was the provider. So even the mourners, they don't have that particular liberty to show their theatrics like the professional mourners. Allow me to say this. Wanango, how have you left us? Why did you have to go that soon? So people don't have that particular moment to just offload their grief. So loss through death causes a lot of psychological trauma. Now, there is another loss that many people are experiencing today. Them who are employed. Some have been laid off. Companies are closing business. And they are telling their employees, it's unfortunate, we can't pay you.
So the economical part of it have been affected.
Yes, that is another loss that people are going through. So imagine this particular breadwinner. And breadwinner here, I'm using it to say the person who is providing for this particular family. It could be the man, it could be the woman. It could be even a child of that particular family. They no longer have work. So what goes through their mind? There's anxiety. There's stress. And if these two are not taken care of, it might lead now to something more severe like depression. So you can imagine you're supporting maybe your own parents, some of your siblings. Now that support, you can no longer give it. So you, as the person who was offering this, you feel a little bit like, you feel woye to yourself. You now feel pity that now I can't support my own family. Mawazo zinaanza kusomba. So if you don't take care of these intrusive thoughts, what will come out of it? You might think, because I can't provide for my family, let me end it all. How many people have we had attempted suicide? During this period between March 6th, I think that is the first time that we recorded a case in Kenya, and maybe yesterday, 16th. I know the government won't give statistics of people that have committed suicide because of COVID. But if you look well, there are several people that have committed suicide because of either being affected directly by COVID or indirectly. Apart from suicide, there are people that have wiped the whole family and also committed suicide, homicide. This is another effect that comes with unresolved issues based on COVID-19, the uncertainty of COVID. The third part that people have also suffered is something we call femicide.
Femicide.
Yes, whereby a man kills the wife so that, quote unquote again, the nagging nature of wives is taken away. How many have we had in the media? So there's a lot of psychological issues going through the minds of many people. Reason being, people don't know the channels just to share out what is going on within themselves. So, because our topic is more on mental health in the midst of COVID.
This COVID-19.
Now, apart from maybe depression, anxiety, stress, what other things do people go through? There's a lot of stigma. Trust you me. Go to Mbagathi. Go to which other? Just across Mbagathi, there is MTC Nairobi, the isolation unit. Now the stigma comes in this way. So long as someone sees you coming from Mbagathi, outside that gate, you already have a label. COVID. So you no longer are called Caesar. You are no longer Calvin, but now you have this label, case number, because okay, we don't know, but now they'll call you COVID. I was looking at the news, I think last week or early this week. There's a guy who does kusafirisha mili to Western Kenya. Alisema sasa biashara hatuna because past Limuru, what do they say? When unatuletea nini? Unatuletea corona. Even if you have the certificate, you're COVID free. Our truck drivers, Mombasa, Busia to Uganda, what are they being told? Unatuletea corona. So they can't even go to the shops. So there is a lot of stigma behind COVID. Be it you are the victim or you're the patient, or be it you are among the essential service providers. So there's a lot of stigma that comes with this COVID-19. And if this stigma is not taken care of, the person who is being stigmatized will go back to what we started with, depression. Because now everyone is saying, oh, I'm case number this, I'm case number that, I'm COVID. So the social fabric again is disintegrated because now I don't have any social support to help me even come out of that particular experience that I had for the 30 or so days that I was in for treatment. So stigma is what is really killing people. Not the physical death, but emotional, psychological, and even asking, where is God? Even our religious or our spiritual being is being killed by this thing we call stigma. Because Patrick has COVID. He goes to Mchungaji or makes a call to Mchungaji. Mchungaji was confirmed positive for COVID. Tutaomba Mungu akusaidie. Don't take their time to come visit with you. I'm a hospital chaplain. So if I'm told to go to Mbagathi and administer my service to someone who is positive, I'm scared for my own life. So will I go? No. Definitely no. But because of the love of Christ, I might go, but keep whatever the government is saying, keep social distancing, wear protective gear before you get there. So even those gears themselves. I'm looking at a country, is it Congo, where we had Ebola. So you see someone wearing those PPEs. I think for Ebola they were using yellow ones. You see someone wearing a yellow PPE, you're saying that kwisha, kuna mtu amekufa with Ebola. So stigma, I think, is the big thing.
The big thing that we need to handle at the moment.
We need to handle stigma, and even this contact tracing and how the surveillance team is picking the people that are on their contact list. So you can imagine, because I interacted with Caesar and I'm positive, they come with sirens blaring to Caesar's place. Obviously, Caesar is a social person. He has neighbors. So long as they see an ambulance, and those ambulances, by the way, they also stigmatize because they are written COVID-19. They are not just normal ambulances, no. They are written COVID-19. So they see COVID-19 ambulance, kwisha. So Caesar will remain isolated, I think, for the next 3 months.
So, back to Caesar. What do you see? What's your take on stigma in the society?
Well, stigma, I think it's been around for so long. I can date it back to when HIV and AIDS started in Kenya, and you could hear how people were talking, you know. Like in Nyanza, people no longer even call it HIV. They were just saying "Wangni walore," you know. You know, this time around we'll be lowering him down there. And, you know, people were talking, you know, even to patients who are just there listening, you know, they're saying, "At this one is going. This is a going case, you know." They're even planning and saying, what kind of coffin do you need? You know, things like this. You should write us a will and tell us if you have other things out there and everything. And so, even a person who maybe would have survived loses the will to live already, because they won't have the mental toughness and the mental strength to even fight the disease. But you know, it came and it ended. Because nowadays people with even HIV can live even longer than us. So with stigma, I believe it's just something that society has created. It's us ourselves who have created it. At times it comes very unknowingly. At times it just comes. You never know. And you can see it even in the matatu. Try and cough today in a matatu and see. People can even run away. People can even come out of the windows of the matatu. Try maybe even receive a phone call today on a matatu on your phone and put it on loudspeaker, and the person says, "I'm from the Ministry of Health. I have your results here and they are positive. Kindly give us your connection." You know, people in that matatu will break their legs because they're saying, "This guy will kill us all," and that's stigma. So I believe we just need to embrace these people. Already they're healthy, already they're back. We need to have a good way of integrating them back to society. I know fears are there. People will always be afraid that, wow, this guy has gone through this. They may infect me.
And there's also an issue whereby we are told you can get treated from home.
Yes.
Yeah, now people are being told to go back home. Yes. Well, let them be treated from home.
Which is quite a challenge, especially for, say, a person who is living in one room with their family.
Yeah.
You know, the model for the treatment at home is for a person who maybe they have an extra room at home that's not being used by anyone, so they can isolate that room and use it for the treatment services of this person or for the isolation of this person. So like that room is restricted to this person alone, and once this person is done with their treatment or with the isolation period, it has to be fumigated as well. It has to be sprayed and sanitized also. So, you know, when you're talking about maybe like, let's say Kibera now has also many cases. Where will a person from Kibera self-isolate at home? Where? It will be impossible because it's only one room and they're sharing it even maybe 5 or 7 people. So, you know, it's a good model, yes. Home-based care is a very good model, but it needs good planning and it needs space. You know, and it needs a lot of things. So I believe the government should really look into how to roll out that home-based care model, especially for the people in the low-income areas and informal settlements.
Okay, I think what the government is doing concerning home-based care, it's a policy they are developing and they are rolling it out very slowly. That's why during the presidential address on the 6th, was it 6th? Yes. He said that we are trying to see how to roll out home-based care. And for this to happen, the counties have to have enough bed space. So you can imagine a place like Kibra, you can't do home-based care because now this is an informal settlement. They share a lot of things. I think in my own knowledge or my own understanding, the isolation wings might remain for such informal settlements. Because look at Kibera. There is Langata on this side, there's Karen on this side. So maybe the Karen people, because they have the luxury of space, and maybe the people in Langata, they could home take care of their sick within the home setting. But the people that are being taken care of at home, they are people with less severe symptoms.
Okay.
Because you can't tell me, because I have maybe my 4-bedroomed house, one is an ensuite, I'll be taken care of there. I need maybe their breathing aids, their ventilators. Do I have the luxury of having a ventilator in my house? Not unless you buy the cylinder and the mask. So the home-based care is for people that have mild symptoms, which could be managed at home.
Okay.
Or what they call maybe the asymptomatic.
That's the thing.
Yes. So if you are asymptomatic and you have that particular check that you're positive, but you are asymptomatic, and you have the luxury of enough space within your house, then it's easier for you to undergo the home-based care, which is still stigmatizing. Because if your neighbors see members of public health, because they're still going to monitor the people that are under home-based care. Because after, I think, 14 days, they come, they do the swabs and check on their improvement. They'll still come with their PPEs. So if they still come with their PPEs, already the neighborhood or the people around know that kwa hii nyumba kuna COVID.
COVID person, yeah.
So as Cesar has said, after all this time has elapsed, you are termed COVID-free. There is a lot of fumigation that is going to be done within that particular house, within that particular home, which again is still stigmatizing. So stigma, I think, is the thing that is really pushing people down the mental health spiral.
Thank you. And we all agree that this is a problem that we have, the stigma. And even us that you are talking, once you know that someone is having it, you will never be close to him. So what are some of the measures you feel we can take to teach people on the issue of stigma? Because it's really affecting people emotionally, and their mental health is being affected. How can we handle that case?
Okay, to deal with stigma, we need to do something in psychology called systematic desensitization. And this one should be done by a professional. Because you might think you're doing the desensitization, yet you're causing more harm. So how does it apply? If I am aware of the emotions, the feelings, the psychological issues behind the COVID, I'll be able to help you out. As a counselor, I'll help you out so that you don't stigmatize yourself and you don't allow the society to stigmatize you. Because the most painful kind of stigma is self-stigmatization. You stigmatize yourself that now you go to your cocoon, oh, I am COVID positive, oh, I can't go back to work. Don't pity yourself. It's just a common flu that has gone just beyond the common that we understand. So don't stigmatize yourself, and when you feel you need to talk, please talk it out. When you feel things are not adding up in your head, can you ask someone else to help you make things add up or put things into perspective? It's like someone who has cancer. The medic tells you, I'm sorry, you have prostate cancer, stage 3. So, in your own readings that you've done, when it gets to stage 3, it's now getting to a point of no return. Now you go to, there's a very good friend called Friend Google. So you Google all the symptoms. Now, this is how self-stigmatization happens. You Google all the symptoms, you're negative. So because COVID, for you to be COVID, to have COVID, sore throat. So you start, okay, I think I have a sore throat. Headaches. Now in your head, you're not suffering headache, but because there's a symptom of headache, you start having headaches within your head. Muscle aches, your muscles start aching in your head. Which other symptom? Chest pains. Your chest pains in the head. So all these symptoms add up to the diagnosis of COVID-19. Are you positive?
According to you, yes.
According to you, yes. According to the medics, you're negative. There's something that we call psychosomatic symptoms. You just feel sick in your head, and the symptoms qualify. That is one cause of serious self-stigma.
Okay.
And people have died out of stigmatizing themselves because of these psychosomatic issues.
Okay.
Because now you feel so helpless. There's something in psychology, and I know, Caesar, you bear me witness, learned helplessness. So you just learn to be there, to be sick. You just learn to die. You will die, definitely. So self-stigma is something that you can come out of by just speaking out your mind, speaking out what you're feeling, what you're thinking, because what you're thinking will really affect what you're feeling.
Is it garbage in, garbage out?
Thank you. In the ICT world, if you feed yourself with negativity, obviously, there is nothing positive that will come out from
So
it.
on the same issue, Nyagudi, you talk about where we get those information like Mr. Google, YouTube and the rest. How can you advise us? Where should we get the right information? Because I'm in many WhatsApp pages, and I see a friend just getting a message. Hata jasoma forwards to family
to
take
friends.
care. If you have this and this, where should we get the right information?
So information is power. But the same power that you're getting this information, that could be your distraction. Look at the informations that are being forwarded to groups, WhatsApp groups, or even Facebook. Some could be credible. Some could be very, for a lack of a better word, bogus. Now, the credible information that is put out there, there are those that will really compress this information after doing a lot of analysis and saying that if this information goes to the general public, it won't cause harm. But if this goes to the general public, it's going to cause more harm and panic than we expected. So you asked about the sources.
The sources, the
Now,
best source.
The best source that I'll give for us are three. And maybe Caesar might add others. We have the WHO, World Health Organization. By the time they post anything on their website, they've really done their research, both medical research and psychological research on the impact this information is going to have. So if you look at their website, and I challenge all of us to look at it, you'll see COVID information. They give very synthesized information that even a teenager will go, read, understand, and doesn't get traumatized.
Okay.
So we have WHO. Within our region or within our country, we have the Ministry of Health. They usually update their data every other day. And if you look carefully in the last updates that CS Kagwe gave, now he wasn't giving the regions, okay, he was just giving a blanket. In the last 24 hours, we have 133. The media people are asking, can you give us specific numbers for specific areas? He said, I'm not going to give you that at this particular sitting. but you will have a copy of that, so that the media people, because they are responsible people, they'll be able to see how do we sift this information to give it to the public. So WHO, Ministry of Health, and there's another one, UNICEF. The one that deals with children. So even with them, they give the same information WHO will give, the same information Ministry of Health Kenya will give, is the same that UNICEF gives. But now it gives it user-friendly even to children.
The children.
Because in this generation, a child in class 3 or is it class or grade 3? Grade 3 already has a smartphone. They can Google anything.
So they try to see the impact of the information.
Yes. Before they relay any information, it is their responsibility to look at what impact is this information going to have to the society. Is it good or is it bad? And I think that is what killed, really made people die in Italy, Spain. Because information was just being poured to them. So they pour this information because I'm now scared. I want to find out, how is Caesar? Is Caesar also having these symptoms? So I go to Caesar. Maybe Caesar was positive. What happens? I get positive. By the time I'm getting back to my house, I've used maybe, they call them the tram, hizo matrain zao. Maybe ilikuwa na watu kaa 30. So from Caesar,
those
31
to your family,
to my family, and to the family of this 30. So it's our appeal that people get synthesized information.
Synthesized information.
Yes, and maybe before Calvin, you cut me short. Not all information is useful. Not all information is useful. And I think the Kenyan media has learnt it. So they don't give, we call it verbatim. So they really synthesize, they edit. They just give you, this happened. Like I think yesterday, but one, they said 4 people in State House tested positive. And that was it. It has never been mentioned again. In the newsprint, they just say COVID at State House. So if you read through, you will find very scanty information. That is their own inaitwa uhuru wao. So they really try to protect. So people need not to really look into a lot of COVID information, because the more you look, the more stressed you'll become, the more anxious, and the more depressed you are likely to get. Yes.
Great. Now, especially on the part of the social part of it, what can you tell our brothers, our sisters who are good in forwarding? I remember I was once a victim, especially the first month, the first week. I was forwarding it into our family page, and I like one of my sister. She was against it, and he said, no, and we were wondering, why are you against it? Why are you against it? We need to inform people. Yet the information that I'm passing are not
they are not verified. Yes.
So what can you still even advise people on the issue of forwarding the messages and in the social media to the society, in the church, in the family, and yes?
Well, for social media, as Patrick has said, it's really important to know what information you are giving out. It's important to see what information you are giving out, because it will either make a person or it will kill them. You know? Because many people will see the messages, they're healthy people, and even those who are in hospital, but they're getting these messages. And they're seeing whatever is happening. So we really need to be sensitive and get the right info before we forward. Verify it, you know, because in fact some people even post things without verifying. Like I'm posting about the Burundian president and the entire family getting COVID and everything. But you know, it's not all that was true. You know, even they're saying that the president himself had COVID and that's what killed him, and it has not been verified itself. So we really need to sieve and verify this
Sieve and
information
verify, yeah.
and ensure that it's good. And you know, the good thing is that even now Facebook gives COVID-19 information if you require it. It's there.
Yeah.
In fact, at the top of it, it gives COVID-19 information.
Yes.
If you require it there. So it's easy for people. We even have Camry, we have CDC, which gives all this information about COVID-19 if you require it. So it's good to verify before
you
sending.
forward it.
And it's even better for you not to forward it. You just remain with it. Let's encourage each other more rather than give out this discouraging news and information. I know personally, even I stopped following these news briefings nowadays. I stopped following them and getting all those numbers because at times I feel like, okay, these things are happening and
It affects you mentally.
yeah, in fact, mentally it affects us because we see, wow, 147, wow. I see my area, Umoja or Komarok is having COVID-19. I start getting afraid and it gives people that fear and even that stigma that we have been talking about.
Thank you. And I'm sure we are sharing this not to condemn, because even us, we are victims in one way or the other. Because the first week we were quick to forward, not to make them afraid, but to educate them.
Yes.
Because I love my family, so if I get any message about COVID-19, I could rush and share it in the family page. I do the same with the church because I love my youth that I work with.
Sure.
So I've received this message. Can you receive it? But now we are being empowered that maybe the best thing we can educate our family members in our church, we need to remind them where we can get the best information.
Yeah.
And our brother Patrick have reminded us the 3 areas that we can get the best information. So that's the only way that if you want the best information, go to this section they will give you.
Sure.
So let us not feel condemned. I know I'm trying to encourage myself because I was a victim. Yeah. So indeed, when we talk about mental health, is a very serious issue that we need to sit again one day and discuss it deeply. And today we were just looking at the effect of COVID-19 on our mental health, and we have seen the things like stigma. We have seen anxiety that is among us, and therefore I'm just asking us, what is the way forward? What is the way forward? Things to do so that we can remain mentally healthy. Even this time that I've lost a job, my business has gone down, my family member is in the hospital, I cannot go and visit them. I'm being surrounded by all these things. You know, when I go back to the Bible says that even 1,000 will fall besides you, but you will remain. So 1,000 have fallen besides me, I'm still here. How can I handle this issue? My husband is in the hospital. My child, my own child is in the hospital. I've lost job, landlord. There's youths come to me and say, oh, my landlord needs money. They are saying that they are going to throw my things out. And therefore I'm affected mentality. So my question to you, Brother Nyagudi, since that's your area, can you swim on it and tell us, how can I remain healthy on this situation?
I think how to remain healthy is very simple, but at the same time very complicated for men. Why do I say it's very simple to remain mentally healthy? By just talking. Despite the social distancing, despite cessation of particular areas of our nation, one thing remains. We can still communicate. Either through phone calls or even meeting, because hatujambiwa tusikutane. Because kama tungeambiwa tusikutane, hatungekuwa hapa. So, just putting in place measures to prevent the further spread of the virus. So, talking one to another, it's a way out. So that we don't just bog ourselves with a lot of issues and stay with them. It's like shaking a bottle of Coke. When you put it still, it will look quite okay. But you will notice it is not okay when you open it. Because things will start pouring out. So number one is find someone that you trust. to talk to and to share your thoughts
Your thoughts.
and feelings. Because the two really work hand in hand. What you think will affect how you feel, what you feel will affect how you think. So have someone to share out on your issues. And it's a pity that men really fear going for counseling. I don't know what happened to us. So men just decide, wacha nitaenda kukunywa mashida zangu. Talk it out.
Talk it out.
Talk it out, talk it out. And there are several professional counselors available. Be it one-to-one, be it over the phone. I know Kenya Counseling and Psychological Association, they offer that service. You just call in. It's only that I don't have the number offered. You just call in and you will receive a counselor. There's a counselor always waiting to talk to you or to listen to you, because it's more of just pouring out. CITAM, they have a very good platform of counselors always ready to listen to you. Kenya Red Cross, they have standby counselors. I think their toll-free number is 1199. So 1199, you'll get to a standby counselor at Red Cross. They also do a very good job. There's an institute in Kiambu called KIBCO, Kiambu Institute of Counseling and Business Studies, something like that. They also have standby counselors. I think people can just check up on their number. There's a money counseling center. Can just give them a call and they'll help you out. The same Ministry of Health
Can also help you.
They will help you. Just dial 719. Is it 719 or 791? That code, they will listen to you and they will advise you what to do. So at the end of the day, help is available.
Okay.
Even our clergy,
I was mentioning the Anglican Church, the Old World and other churches. I know they are. I see them in social media as they preach. They are giving us their number there. Baptist Church, the Anglican Church, and I know I can speak about Anglican Church. All church is not closed. Church are open. It's only that big gathering is not happening. Yeah. But once you call for a vicar, a provost, an archbishop, they will pick your phone and they will help you. Yeah. So churches are doing good job, by the way. You need to appreciate the pastors.
We really appreciate their work.
The bad thing that people are normally condemning pastors and mocking them. I believe that led by the Minister of Health and the rest need to repent and ask for forgiveness. Because pastors, when we call for a church, when they call for a church, it's for spiritual nourishment, things like counseling. They are not only for offering. So when they are calling people that let's go back to church, let those who are non-believers not think that church is only looking for offering. No, we are looking for the souls. Because even right now, I know Christians who are supporting church at the moment. They are sending their offerings. But the pastors are not feeling comfortable of receiving offerings, but they are unable to offer the counseling part of it. So I want to tell listeners that wherever you are, whether you are in that your church, there is a pastor who is really waiting for you. Anytime you call that pastor, they will help you. So don't suffer. If you are a Christian, don't suffer. Call your pastor, call your brother or sister in Christ. You can share together with them. Maybe you have lost a job. Maybe the landlord is going to close your house. Speak out. You will be helped. Caesar, maybe as we finish, any solution that you can give us? Me nilikuwa natetea to pastors. I'm passionate because I've seen people mocking pastors as if they are just looking for money.
That's true. Yeah. So for me, let's just follow the simple steps that we've been given by the Ministry of Health, by the WHO. Putting on a mask anytime you're in a public space. Washing of our hands, it's very important. Maintaining that social distancing, very key. And I believe with all that, we will surely be able to beat this disease. And of course, our brothers or sisters who are coming out of quarantine and treatment. Let's receive them with love. Let's show them love. Let's stop stigma. Yeah, I know stigma has been there since time immemorial, you know. Even the lepers, you remember the lepers, you know, they're on their own. But we just need to show them love. They are our people, you know. We know some of them came from abroad. They also used to send you money and bring you good things. But now you're now stigmatizing them, you know. Yeah. Things will be back to normal, and they'll go back, and you'll have to talk to them again. So just let's show them the love. Let's maintain all the precautions that we've been told to maintain. And I believe with time, we will surely be able to beat this disease, and life will be even much better than where it was before. Thank you
very much. Now, as we make the final remarks on this, we can just say that it has been a great moment, and I want just to hear the final comment from my brother Patrick Nyagudi.
My final remarks will be, we can defeat COVID. If we defeated Ebola, COVID is nothing. We can be able to defeat COVID. Let's just maintain the guidelines and the policies that the government has put in place, because these are well-researched information and well-thought ideas that the government has given. So it's just for a while. Things are going to become better. I won't say things are going to go back to normal. Things are only going to become better, because we can't go back to the normal. Yes.
Mr. Caesar, what's your final thought on this issue of mental illness or mental health?
As a firm believer, number one thing is, let's just obey the government, number one. Let's listen to what they're saying. I know we are tired. Some of us are so tired of being indoors. Some of us are so tired of being confined in our homes and in Nairobi, because I know I have friends who every weekend they were on the road going up country, but now they are here and they feel like their life is over. So let's just follow the guidelines and keep hoping, keep praying for those who are suffering. Show them love. For those who lack, you can support them with something. You know them in your community, so you can be able to give them some food, give them some resources that they need to be able to go through this period. For the landlords, for the agents, bear with the guys who are unable to pay rent, because indeed it's tough for everyone, and we even understand that the landlords, even for them, they need this money to survive. So let's just keep each other in prayer. Let's keep hope. Let's keep being hopeful as we anticipate maybe the opening of churches and even resumption of local flights. I believe things are getting better, as Patrick is saying. And if you need to talk to someone, talk to someone. Get a counselor, get a friend, share with them. And I believe hakuna haja kufa peke yako. We are here to carry each other's burden. We are a community. We are Africans, and we are known for being very strong in terms of community and uplifting each other. So let that not stop, even though virtually.
Thank you. All in all, one thing that I can say from the professionals, I was the lay among them. I can say that talking is the only way. You need to talk, you need to speak out. Even with the landlord, you need to just have a meeting with the landlord and negotiate with him. That, brother, my sister, I lost my job, I'm unable to pay. Can we wait until this? I'm doing a small business, I can be paying you maybe 1,000 per month, and I will pay you all amount when I get back my job. I'm sure if you have time and talk with your landlord, a big percentage will hear you.
Understand.
I know also we have loans, because some of us, we took loans to build houses and to do other things. Maybe when the car you are driving is a loan, maybe school fee. You only need to negotiate with that person. Maybe it's a circle, maybe it's a organization. Just go and negotiate with them, because from the professionals we get that it's about speaking. If you speak it out, then the mental health will be very positive. And we know that mental illness, it's something that is affecting people, not only when in COVID-19. We have people having depression for many different things, maybe because of divorce of a parent, or divorce of a friend, or maybe many issues that we have. But today, we just narrow it to talk about the effect of COVID-19. There are counselors. I know this program will be here maybe forever when we are still on this earth, God willing. The thing that we will do is to reach you people and talk to you. They are professional counselors, they are practicing counseling. If you need them, just contact me in the number down there. I will give you their number. They can really help you so that you can overcome. Let us speak out. Let us have that habit of speaking. Nyagudi have challenged men. Men, let us speak out. Let's speak out. Speak to your pastor. Speak to a counselor, and we shall get healed from these mental issues. Thank you for today. Thank you for subscribing to this channel and even liking and sharing it. We really appreciate each one of you for being part of us. We intend to learn from one another, and we believe that we shall overcome and we shall maximize our potential in this earth. And when we go back to heaven, we shall tell God we did our part. May God bless you till we meet again. Let's pray. Dear Father, we thank you for giving us this opportunity to learn about mental health. Indeed, the Bible reminds us to speak. When God, you call us to reason together with you. And you have given us opportunity to speak to one another. The Bible reminds us that one of the vision of Jesus was counseling, when the book tells us that he will be the wonderful counselor and he will be the Prince of Peace. I pray for those families who have been affected positively and their family members are in the hospital, that Jehovah Lord, may you give them peace that cometh from you. I pray even for those who have lost their job, those that their business has gone down and they are asking themselves many questions. The young people whose houses are being closed at this moment, Father, I pray, may you help them and give them courage to go and negotiate with the landlord, to go and negotiate with those people looking for them to pay back the loans that they took. And Father, I pray that may you bring peace and understanding, Jehovah Lord. Thank you for this season. In Jesus' name we pray. Amen. Thank you. Till we meet again in the next episode. May God continue blessing you. Thank you.